Cognitive behavioral therapy, CBT, is a widely used therapeutic approach that focuses on the interplay between thoughts, emotions, and behaviors. It is based on the premise that negative thought patterns contribute to emotional distress and maladaptive behaviors. And by changing these thoughts, individuals can improve their emotional well-being and overall functioning. CBT is structured, goal-oriented, and typically short-term, making it an effective treatment for various mental health disorders, including anxiety, depression, and PTSD. The history of CBT can be traced back to the mid-20th century, with contributions from several key figures. Psychologist Aaron Beck is often credited as the founder of cognitive behavioral therapy in the 1960s. Beck developed cognitive therapy as a response to the limitations of traditional psychoanalysis, emphasizing the importance of identifying and challenging distorted thinking patterns. His work laid the groundwork for what would later evolve into CBT, integrating behavioral techniques to address emotional and psychological issues. In the 1970s and 1980s, CBT gained popularity as researchers established its efficacy through empirical studies. The integration of cognitive and behavioral strategies provided a comprehensive framework for understanding and treating mental health conditions. Today's CBT is considered one of the most effective therapeutic modalities, supported by extensive research and clinical evidence. Modern practices of CBT involve a structured approach that typically includes several key components: cognitive restructuring, behavioral activation, exposure therapy, and skills training. Cognitive restructuring helps individuals identify and challenge negative thoughts, replacing them with more balanced and realistic beliefs. Behavioral activation encourages engagement in positive activities to combat feelings of depression and anxiety. Exposure therapy is particularly useful for treating phobias and PTSD, gradually exposing individuals to feared situations in a controlled manner to reduce anxiety responses. Skills training focuses on developing coping strategies, problem-solving skills, and emotional regulation techniques. Numerous studies have validated the effectiveness of CBT through various tests and assessments. The Beck Anxiety Inventory, BAI, is one such tool used to measure anxiety levels and track treatment progress. It consists of a series of questions related to anxiety symptoms experienced over the past week, providing valuable data for clinicians. The Beck Depression Inventory, BDI, is another widely used assessment tool that measures the severity of depressive symptoms. Both BAI and BDI have been extensively researched and utilized in clinical settings to evaluate treatment efficacy and guide therapeutic interventions. Research has shown that CBT can lead to significant improvements in mental health outcomes. A meta-analysis examining the effectiveness of CBT for anxiety disorders found that it significantly reduced symptoms in up to 70% of participants. Additionally, studies have indicated that the skills learned in CBT can lead to long-lasting improvements, reducing the likelihood of relapse following treatment. Understanding cognitive behavioral therapy is essential for mental health professionals and individuals seeking effective treatment for emotional distress. As research continues to expand the knowledge base surrounding CBT, its applications are likely to grow, benefiting a wider range of individuals in need of support. Through the structure and evidence-based approach of CBT, individuals can gain valuable tools to manage their thoughts and emotions, ultimately leading to improved mental health and well-being.